Hey, pharmacy technicians, we are reviewing for our pharmacy technician exam, and we are in chapter 24 and 25 this week. So I'm just going to point out a couple of things that I think are important to remember since I have taken the exam and I remember them on the exam. So starting on chapter 24, 261 in our book, we're talking about cardiovascular systems. Remember to break words out. Cardio is heart. Vascular is the blood vessels. So we're talking about the heart and our blood vessels. Remember to start doing that with words. On the test, they'll come up with some words that you might not have seen before. And if it has cardio or vascular in it, then you can kind of decipher what the word is from there. You don't have to know what the word is. You can just break it down and that's how you'll know. So just remember, these type of drugs that we're talking about, I always remember my ACE inhibitors. Those are our PRIL, ending in PRIL. These are PRIL drugs. And then our beta blockers, our beta receptor antagonists, excuse me. I can't talk today. Remembering that all of these medications are helping to decrease blood pressure. 120/80 is normal. This is systolic over diastolic. Systolic is the top number, diastolic is the bottom number. Systolic is the number that is our heart under pressure when it is beating, and then diastolic is when our heart is at rest, and that is the 80 to almost 90. So prehypertension is about that. You want it to be under 80 to be normal. So these drugs help to lower either one of those, and they do it in a way of either dilating the blood vessels or decreasing our heart rate so that, or in increasing the dilation of our blood vessels. That is how our beta blockers work. And there's also something called water pills. Remember, that is something that if you're pre-hypertension that you will take to help lower some of that pressure off your heart. So they are saying that maybe extra fluid in your body is causing some of that pressure, so they'll take what is called a water pill. This is like Lanoxin, Digoxin, and helps increase some of that water excretion out of your kidneys. Remember, if you do have a kidney disease, they will not give that to you because trying to excrete more water through your kidneys will not work. So you'll have to take something else if you have kidney disease and hypertension. But if you don't have kidney disease, they usually put you on a water pill first. And remember that we do not take that at night. We take that only in the morning because it will increase your urine outtake. All right. So make sure that you read through that. And also, if you go back into your pharmacology book, if you've taken this class yet, there is some really good, a chapter on here that is cardiovascular. I think it's chapter 11. Let me just look for you really quick. Yeah, chapter 11 in your pharmacology book talks all about that. So if you are not finding a lot of information in your pharmacy text review, reread chapter 11 in pharmacology. That will help you remember and maybe answer some of these questions. Okay, diuretics, which we just talked about. Let's move on to chapter 25. This is what our discussion question is about. These are your pulmonary agents. Pulmonary is anything to do with lungs. So we're talking about inhalers here. Albuterol, the biggest one. When I worked in the pharmacy a long time ago, they had an albuterol inhaler recall. That was huge for people. What were you supposed to do without an albuterol inhaler? Because they'll even give that to people who have coughs and colds, and that was a huge deal, and we couldn't get our hands on them, and so a lot of people were very worried about what they were supposed to do, which it was a kind of a scary time and not knowing what to do. And then a lot of kids are also on nebulizers and things like that. So those are the type of pulmonary drugs we're talking about. And prednisone, which is a steroid, which they can give to you to decrease lung inflammation. Maybe there's a lot of inflammation in your lungs, maybe from asthma. This is discussion question. Asthma causes a lot of inflammation in your lungs. And if your lungs are inflamed, then they cannot do what they're supposed to, which means inflating to the point where you can take a deep breath. We take that for advantage sometimes, non-asthma patients, knowing what it would feel like for an asthma patient. It makes you wheeze. The asthma actually restricts, although you're thinking the inflammation would be wide. It's actually the muscles around the lungs that are causing your lungs to not be able to inflate all the way. And so you're taking really deep, short breaths. And you know that when someone's doing that, they're not getting a lot of oxygen to their brain. So they can actually pass out from that. And so they'll give a steroid to decrease the inflammation around the lungs so that then you're able to breathe better. And your discussion question asks, how would you get off of a steroid, a corticosteroid, so that you can because being on a steroid for a long period of time, you know that there's a lot of side effects out there on steroids. And so being on that can really decrease its value and then increase the side effects as well. And so you can read about that on 303. It's kind of just what we talked about, and be able to answer your discussion questions. And then you have a short review of the odd questions on that. If I was you, I'd do every single review question. Get your hands on every single review question so that it's asking you, although we're only making you turn in the odd ones, make sure that you're doing more. Just do the extra work so that later on the test, you're like, oh yeah, I answered that. This is easy. On to the next question. So if you have any questions, please let me know. I'd love to help you get registered to take your certification exam and to move you to that next level. Or if you have any questions on pulmonary or cardiovascular drugs, I would love to help as well. Again, refer to other books in our pharmacy classes. Pharmacology was a good one to look back for cardiovascular drugs. Sometimes this review can only be just some of the key stuff. It doesn't go back and talk about all of it. And so for me, if I forgot it, I want to know kind of the details of it and not just the key facts. Have a great week.